So I promise I'll go through this case of a 63-year-old man with a 30-year history of alcohol abuse, vomiting blood in your clinic. So alcohol abuse means that he's been drinking lots of alcohol over long periods of time, and this damages several organs, most notably one's liver. So this organ here, this is the liver, and this piece of tissue here is the esophagus or the food pipe, which we have opened this way. And what we're looking at right now is the inside surface of the esophagus. That is the surface that food rubs against as it's going from your mouth to the stomach. Of course, the esophagus is much longer than this. We are just showing you a small section of the esophagus in this pot. If we compare a normal liver here with this problematic pathological liver, we are seeing that the main abnormality in the liver is that it is very nodular in appearance, which means that you can see small little nodules or rounded lesions. That is a diffuse kind of thing happening all throughout the surface of the liver. So what has happened microscopically for the liver to look like this? So the nodules are actually nodules of liver cells. Liver cells are known as hepatocytes. So these are nodules of hepatocytes. And why does it look nodular in appearance? It's because it is being divided and separated by fibrous tissue. Fibrous tissue. Remember collagen, fibrous tissue. It should look more pink under normal circumstances. But what we are seeing here is that it's looking more blue because it is infiltrated by lots of chronic inflammatory cells. And in this case, you should appreciate that they are small, dark, round cells. So these are lymphocytes. Okay, so there is constant chronic inflammation. There are efforts at repair and regenerative nodules. The nodules are regenerating because there is ongoing tissue injury. So when I say these three things in tandem, you should be having some idea that I'm trying to tell you that there is some chronic inflammation happening in this liver. And this chronic inflammation is, as I mentioned, the secondary result of long-term alcohol abuse, continued long-term alcohol abuse. So the process here is actually fibrosis with regeneration of hepatocytes. Okay, and sometimes on the surface of the liver, you can also still make out this whitish appearance. This is all the fibrous bands, the fibrous tissue that is separating these nodules of liver tissue. So there is fibrosis, as I mentioned, in the liver, leading to the nodules. There's continued inflammation as seen in the lymphocytic infiltrate, as well as constant cell damage, hepatocyte damage, and regeneration. Over time, his liver will get damaged, and that means, as you know, in inflammation, what do we see? Loss of function. So there will be a loss of function of the liver. In order to figure out what happens to the patient when there's loss of function of the liver, you basically need to know what the liver does first. And for your information only at this point, you're not required to know this, but the liver has got several functions. For example, to make proteins and to make clotting factors. So if the liver is damaged and unable to make proteins and albumins in the blood, you are going to get things like ankle edema. You will also get lots of bleeding tendencies. The liver cirrhosis also leads to something called a portal hypertension, which means the vessel that's leading into the liver, the portal vein, is very congested. The pressure inside is very high, and because of that, there are also several other clinical features as well. As I mentioned, this diagram is again for your information only at this point. I failed to speak about why does he have vomiting of blood, and that's a very interesting feature. So in a patient with liver cirrhosis, what happens is that the portal hypertension that happens leads to shunting of blood. So the blood, instead of flowing in this portal vein, it gets diverted to another area. It gets diverted to around the esophagus, and so the esophagus blood vessels become very, very prominent, as you can see from this picture over here, you might appreciate that this is very big, fat, tortuous vein. And when that happens, when one eats food, it may actually cause abrasion, basically rubbing, and then this epithelium gets damaged, and then there will be torrential bleeding, and hence the patient will vomit blood as a presenting symptom. Okay, so the learning points of this is that repair fibrosis can lead to bad features. Okay, and similar to the heart, when there's excessive fibrosis in the organ will not be able to do its function. Worse if the patient continues to damage his liver by continued alcohol abuse. So finally, just as a reminder for you guys, when we think about loss of function for an organ that's affected by inflammation, you first need to know what the organ does, then you will be able to derive this with basic principles. Thank you very much.